I'm the Regional Director of Nursing and Midwifery, and I am responsible for all the nurses in the region. We have Norseman, which is a small hospital 2 hours away, and Esperance is the next one south. Then to the north, we've got Leonora and Laverton hospitals. So there's nurses working in quite a variety of areas in the region.
It's hard to imagine working in a tertiary facility or working in a metro area that you'd really get the breadth of opportunity that you get in the country. The most rewarding part of my job is I know that it's something that is valued by the community, that I can really stand up and with my hand on my heart think that I'm contributing to the community, not just in Kalgoorlie but the whole of the Goldfields.
I really feel like it's a community sort of nursing, sort of have connection to almost everyone here that you meet, and I feel like that I'm helping out my people as well at the same time.
We have a range of different nationalities, demographics. We have quite a high Aboriginal and Torres Strait Islander population, so we do often work with those communities, and our clients do have sort of a unique set of challenges being in a rural or remote location.
We also have face-to-face cultural awareness workshops where we go a bit in depth, more in depth, and it's localised to the Goldfields on how they would engage with Aboriginal patients and consumers in relation to communication strategies, gender, historical context.
WACs really promote working in partnership with our clients, and that's vital when we're working with minority groups such as Aboriginal people in Australia to learn how to work with a mutual respect.
We have a newly qualified nurse program, and that's been running for a number of years. As part of that program, nurses are put through a range of areas to develop their skills.
I came out to Kalgoorlie for my graduate program in 2018, and I've stayed ever since. Working here has given me plenty of experience that I would not have had anywhere else, including advanced skills that normally are reserved for nurses working 5-10 years within a particular specialty that I've learned within 3 or 4 years. There is support from all aspects within the health service to progress your career and support you in learning new skills. Working here has changed my career and also helped my career in ways that I could not have imagined.
There's so many opportunities, especially, you know, as a newly grad nurse. Say if I didn't want to stay in mental health, there was always opportunities to go and transition into a medical ward. It's a massive learning opportunity for especially new nurses, but definitely for anyone who wants to expand their regional experience, I would say.
I've been here for 12 years at Kalgoorlie Hospital because I have found there is a lot of opportunities for my career. I get a lot of support from the professional development, which has fostered my skills, and actually had the opportunity to do a lot of experiences working across the whole hospital.
We don't just stay in Kalgoorlie, you go around the Goldfields, so Esperance up to Leonora or even communities around. Just getting a foot in the door in Kalgoorlie can take you sort of all around the Goldfields as well.
So when I first got here, I stayed in nursing accommodation, which was a large 40-unit area that was gated and had very good security.
We can assist in supporting your relocation costs, whether it be towards flights out to Kalgoorlie or wherever in the region, or relocation of your personal effects as well. There's a real variety of options available to support you for accommodation out in the region and relocation. It's the most welcoming community I've ever lived in. Your first day of work, if you tell people what you're interested in or what sport you play, you'll be on a team, you'll be linked in with someone who enjoys that hobby as well.
I believe we have a great work-life balance in Kalgoorlie. It's a small town, so it's quite quick to get, say, from work to daycare and home.
Great social life in Kalgoorlie, lots of fun, lots of activities there for young people, lots of sporting activities as well, lots of restaurants and places to go out. There's so many opportunities for families here too.
I love being so close to going out bush and going out, being on country as well. I love getting involved in community sport. I play football and I play basketball.
Kalgoorlie is one of those magic places, and the Goldfields is one of those magic places where within minutes you can feel like you're away from it all. You're away from the town, you're away from the hustle and the bustle. Esperance is on our doorstep, so you can actually drive down in a few hours, about 3.5, 4 hours, and you'll be to Esperance. The best beaches in the world are right on your doorstep.
As I found, there was multiple things within the community that made this feel very much like home.
It'll be the job that changes your career. It'll give you the experience that will take you to your next step. It'll give you opportunities that take you to the next step, or it'll give you the chance to really connect with patients, clients, families and a community.
I moved straight out of home to Kalgoorlie. My mum said, I'll see you in 6 months, and now, yep, 4 years later, I'm still sitting here.
If you come and work in the Goldfields, it will be a decision that you will never regret.